Now, today we are talking about the second part of hypertension, management hypertension. And in this case, this session, we will focus on the complication that arises from hypertension itself, right? I will cover quite extensively on those important complications and also give you as much as possible the relevant advice of how to take care of it should you have the complication. All right. Now, before we start, let's look at what they call the blood pressure definition itself. So what is our normal blood pressure? Actually, we have said that the normal blood pressure for most of us is actually systolic of 120 below or diastolic of 80 below. This is considered a normal blood pressure for us itself. But the fact is that actually our blood pressure actually increases with age. So if you look at this chart itself, right, both the systolic blood pressure and diastolic blood pressure actually increases as we get older, right? For instance, the systolic blood pressure can be at for the youngster, 20 years old, it actually can be at 120. But when we hit the age of 60, for instance, right, our average systolic blood pressure can be actually at 132. So therefore, when we go for blood pressure measurements, very often the age matters as well. So for older people, if you are measured with a systolic blood pressure of 130 and a diastolic pressure of 85, don't be alarmed. You are not actually having hypertension. In fact, you are still fall between the normal range of our blood pressure measurements. Okay, another thing on the blood pressure measurements is that I think before I continue, I also want to remind everybody that in my last session, I will say that having a home blood pressure meter is a very important part of our modern life because it's a very useful tool, right? So now, what we're going to talk about is having that blood pressure monitor meter, right? How and when we should actually measure our blood pressure to make sure that we have an accurate reading of our condition. So the first thing is that there's two timing that is the most suitable for us to measure our blood pressure. One is actually before our sleep, right? You can see from here that this is a chart showing our fluctuation of our systolic and diastolic blood pressure over the days itself. So the peak, in fact, there's some peak area. The peak area is before the midnight, which is before we are sleeping. This is the area that we want to detect our blood pressure. And then at the same time, after when we are asleep, actually our blood pressure drops, right? Then when we are awake, there is also another peak, which is in the morning. So therefore, the best time to measure our blood pressure actually is before sleep, before bed, and immediately after we wake up. All right. So these are the 2 points of measuring blood pressure, which means that if you were to measure blood pressure, actually we should at least measure twice a day, one before bed, one in the morning. All right. Now, how to measure? So assuming that we are using a home-based blood pressure monitor itself, so the first thing is that we actually have to make sure that we do not consume caffeine or exercise or smoke between 30 minutes before the measurements. That's the first rule of thumb. It means that you should not take things that actually can excite or increase your blood pressure itself. Right. Second thing is that you actually should let yourself calm down. Right. So sit quietly for about 5 minutes in a chair will be good. Right. And actually with the arm supporting the heart, heart level, then you can measure the position itself. Actually, after that, for your measurements of blood pressure, I think that the first thing, if you are doing it first time, right? First, you try to measure the both arm. You will find that the both arm will give you slightly different blood pressure measurement. Now, for you to continue subsequent measurements, use the arm with the higher reading, right? So that will give you a better critical reading point itself, all right? Then take at least 2 readings for each time you measure. right? And 1 to 2 minutes apart, average them. Then that would be your average blood pressure. But if the two readings are very much different, right, very significantly varies, then you should take additional readings, then you do an average of it itself, right? Now, for the home-based blood pressure measurements itself, right, the current criteria for consider hypertension for a young adult is actually as if you have your systolic higher than 135 and your diastolic higher than 85. That's the definition of hypertension. Okay, now let's look at the complication of hypertension, right? Now, the first part of it, the chart on top itself show you the cause of hypertension mortality. So you can see from here that stroke account for the 65% of the cause of hypertension mortality, which is the major cause of hypertension mortality is stroke, okay? Followed by a heart disease, which is 25%, and followed by renal disease and hypertension emergency. So basically, in terms of the cause of mortality due to hypertension, stroke is a major one. Now, if you look at it itself in the bottom table here, you can see that actually strokes basically is the hypertension complication affecting the brain itself. So basically, basically at the early stage, you will have an eye problem, you will have brain lesions due to that, and then you have a what you call transient strokes, and then you have a case of dementia. These are actually all the complications arises from the hypertension of the brain blood vessel itself. And then, of course, at the acute case, actually is stroke itself. Now, hypertension complication related to the heart itself, basically, you can see from here that it can eventually cause irregular heartbeats. It can also result in congestive heart failure. It can also resulting in actually the heart attack, which is actually the acute form of a coronary artery disease itself. And for hypertension complication affecting kidney itself, you can actually have a complication like proteinuria, right? Hardening of the kidney itself. Then you have a chronic kidney disease, and of course, eventually the acute case is actually an end-stage renal disease or the dialysis of the patient. Okay, now let's look at the risk factor, right? If you look at it itself, hypertension are very closely related to cardiovascular disease. And you can see from here, the first chart on top is here. Hypertension actually is considered the major risk factor for cardiovascular disease, right? Now, followed by overweight, obesity, and then followed by lipid disorder. If you look at it itself, for the cardiovascular disease risk, so hypertension is the top risk factor, right, for that. And how does it affect both men and women? You can see from here, right? This chart below here shows different stages of hypertension. The black one are actually the mild form of hypertension, which is basically the normal. Then the red color are the actually hypertension stage 2, which means the most severe form of hypertension. And you can see for both men and women itself, right? Over the age, as your age progresses itself, right? Your risk of actually having hypertension over time, over the age itself, actually increases. Both for men and women itself, the curve are the same, very similar. That as you get older, your risk of having hypertension increases with your age. All right. Now, we talk about hypertension and we talk about complication itself, right? Now, a lot of us will probably thought that the most important and significant complication arises from hypertension, stroke, as we indicated in the mortality chart here. But in reality itself, right, there is one type of hypertension acute complication that's most fearful one is actually what we call aortic aneurysm, which is actually aortic dissection, right? So aortic dissection actually is what? It's actually our aorta, which is actually the main artery that's out from our heart, and the main artery that carry the blood itself, right? having a tear in the lining between the layers of the aortic wall, and therefore resulting in the blood flow in between the layer. This resulting blood flow into the layer is called aortic dissection, and resulting in the loss of blood in our blood vessel system. And in fact, this is the most feared acute complication of hypertension, right? How serious and how fear is it itself? You look at it itself, the chart below here, right? Never mind about the type A, type B. The type A, type B are different types of aortic dissection. Type A basically is for the ascending aorta dissection, and the type B is as a descending aorta dissection. But it doesn't matter. For all of us, we just want to know, for patients who suffer from aortic dissection itself, what are the characteristics of the patient? You can see from here that this chart that about 75% of the patients who are suffering from AD, aortic dissection, are actually having hypertension. So basically, hypertensions are associated with a high risk of aortic dissection. Right. So this is actually, in fact, one of the most feared complications. Let me tell you why. Right. First of all, right, aortic dissection can quickly lead to death from insufficient blood flow to the heart or complete rupture of the aorta itself. You can see from here itself. Now, it is a life-threatening condition with a lethality rate of 1 to 2% per hour. Now, very important, this 1 to 2% per hour means what? Between 24 hours, you will have a lethality of almost 50%. Between 24 hours. That means that on onset of the symptom, right, you can die between the day. 50% of people will die within the day. So, right? So what are the symptoms that actually are on aortic dissection? Right, based on actually the two types of aortic dissection, standard A and type A, type B, doesn't matter, right? The most common symptom for aortic dissection, right, the symptom actually is chest pain and back pain. You can see from here itself, right? Now, all the other symptoms like abdominal pain, elevated blood pressure or low blood pressure, or syncope, which is basically a collapse, a person collapse, or stroke-like symptoms itself, are actually considered the not so prevalent. The percentage of it itself are actually much lower. So therefore, this problem with this, the fearful part of aortic dissection actually is that, first of all, very often, except for chest pain and back pain, the symptoms, some of them, most of them doesn't have any symptom on onset. And that actually is where the mortality and lethality where it comes. Because you can see that between 24 hours, if you do not get treated, actually 50% of people will die from that. Now, so putting it away, for the case of aortic dissection, time to diagnosis and treatment is the most critical part of it itself, right? And you can see this chart here, the aortic dissection itself, right? And you look at the percentage of mortality. For the general result shows that if you are suffering from that, from the onset with the aortic dissection itself, if you are undergoing an emergency surgery, right, your chances of survival for non-rupture one actually, or what they call the chances of dying, is actually close to about 30%. But if your aorta is ruptured, your chances of dying during the emergency surgery is more than 50%. So basically, people who suffer from aortic dissection have a very poor survival chance from onset, right? And a statistic show that 20% of the patients with aortic dissection die before reaching hospital, and 30% die during hospital admission. And basically less than 50% survival from onset itself, right? So even if you are actually under treatment and reach hospital in time or under treatment, you look at this chart itself, for the 14 days, the cumulative mortality rate for all types of surgery or medication, the treatment itself, all the patient, in fact, it falls at about 20%. That means that even with treatment, between the 2 weeks time frame, close to 20% of patients will still die. Right? Now, in here, if you look at it itself, from the long-term part of it itself, which means 60 days, all right, you can see from here that based on the types of aortic dissection, your survival between the 60 days of the onset of it itself is also very bad. In fact, for the type A, basically the survival, even after 60 days of treatment, is actually that you only have 70% survival, right? So that's where the fearful part of aortic dissection. Without much symptom, but it's very deadly, and very deadly. Time to treatment is very, very important. And if you look at itself, if you survive the treatment, right, the long-term survival remains poor for aortic dissection patient after the repair itself. You can see that typical repair is actually putting a sheath on the aorta that is actually a crack here. You can see from here that for the type A aortic aneurysm itself, actually the survival over the years itself is still dropping. Now, the point is that if you survive your survival of aortic dissection itself, you must take serious precaution in maintaining cardiovascular health after that, right? And especially for aortic patient itself, your what they call your resting blood pressure must be below 110 if possible, right? Maintaining your blood pressure well below 110 on a systolic blood pressure. This is one of the recommendations for you to prevent long-term complication of it. All right, now another complication which we all know, and in terms of the hypertension, is actually the stroke, right? So stroke itself, we can actually divide it into two types of stroke. Or stroke that actually caused by blockage of the blood vessel account for the 87% of actually the current stroke incidents, right? We call it ischemic stroke, all right? Stroke that actually due to rupture of blood vessel, right, is called hemorrhagic stroke. And hemorrhagic stroke account for about 13% of the stroke incidents itself. There's also a form of stroke we call it mini stroke. Mini stroke actually technically we call it transient ischemic attack, which basically your blood vessel is actually temporary blockage of itself, so resulting in sudden weakness and numbness and speech difficulties and sudden vision changes. And this basically symptoms will go away. It's a transient symptom. So basically, that most people who suffer this itself might not even realize it because the symptom disappear and goes away over time. It's just only a short duration. Now, actually, mini stroke is a prelude to a serious stroke to come as well, right? So now let's look at the risk factor for stroke. What are the risk factors for stroke? You can see from here that actually, apart from atrial fibrillation, which is actually the irregular heartbeat itself, actually hypertension, right, is one of the major risk factors for stroke, followed by sedation, that means that a lack of physical exercise, followed by your low HDL-C, which is low good cholesterol itself, right? So if you look at it itself, actually hypertension, other than your irregular heartbeat condition, right, actually hypertension is the major risk factor for stroke. Now, and if you look at it itself, the second chart here, right, the stroke risk, right, significantly increase as you get older, right? And at the same time, if your the different color here represent different hypertension stage. The one which is the red color is actually a hypertension stage 2, right? The one with the green is actually considered as normal without hypertension. But you can see from here that if you have hypertension, the older you get, the higher your risk of stroke go up. In fact, the risk of stroke can go up at 70 years old, can go up to 30% if you are suffering from hypertension stage 2. Right. Okay. Now, what are the signs of stroke? Now, it's important. These are practical things that we must be aware, right? So the first thing is that if a person suffers from stroke, you know that the damage is on the brain, all right? On the nerve and the brain itself. So first thing you look at is the face. The face, one side of the face will be slumped, slammed down. You can see from there. There'll be one face will be slammed down. And then on the arm side, basically, you can ask the person to raise both arm, and one of the arm cannot be raised. I can for sure. I'll tell you that for a stroke patient, one of the arm will not able to raise the arm. And then the person will probably have speech problem, and because of the slur, because of the damage by the strokes on the nerve side. But there are other symptoms like numbness, weakness of the body. The patient might feel, right? Vision change in one or both eye itself, right? Trouble swallowing, or you might have a symptom like severe headache, right? Or you have actually a problem of dizzying, walking or balancing, and having confusion in that. Right? But most common, in fact, you can see from there that generally from the sign, the face itself, you see that it's uneven, right? And the arms cannot be raised, both arms cannot be raised, and then the speech is a problem, right? Now, important, call ambulance right away about sign of stroke. If you have any of these signs of stroke, it's very important to call it straight away, because it is for full recovery. Anti-clot medication must be given within 4 hours for full recovery. So I show you the chart here, right? You can see from here that, right, if you are admission from for treatment, right, from the onset of the stroke itself is more than 5 hours, your odds ratio for good recovery actually goes down very rapidly itself. Now, I put it the other way. Look at another chart here itself. Since we talk about stroke, we have two types of stroke. The hemorrhagic stroke actually are more severe and have poorer survivability compared with the ischemic stroke, which is a stroke that's caused by blockage itself. You can see from here that within a month, the survival chart for stroke patient itself, right? The black color one are actually the ischemic stroke, which is actually the most common form of stroke itself, right? So between the month, if you have a stroke, the chances of survival actually is still about 80%, right? But however, if you are suffering from the hemorrhagic stroke itself, there are two types of it itself, but doesn't matter. You can see that the survival probability actually start at even at 80%, right? Drop very rapidly to about close to 50% within a month, which means that if you are having a hemorrhagic stroke itself, your chances of survival within a month is only 50%, which means hemorrhagic stroke is actually a more serious form of stroke than the ischemic stroke. All right. Now, so put it that way. Now, patients with prior strokes are having a high risk of recurrence. You can see from here, both hemorrhagic stroke and ischemic stroke itself. Once you have a first stroke, the chances of you having repeated recurring strokes are very high, and higher for hemorrhagic stroke compared with ischemic stroke. And at the same time, in terms of survival, all right, if you are having a recurring stroke, your chances of long-term survival actually are very bad. In fact, you can see from here, this chart, right? Compared with non-recurrent stroke patient itself, the 15 years long-term survival chart show that, right, if you don't have a recurring stroke, all right, your chances of survival is virtually very good. You only drop by about 10%. Whereas, if you are having a recurrent stroke itself, right, your chances of survival drop to 15%, 50%, right? In fact, between about 10 or 12 years to come, right? So the point is that, right, if you have a stroke patient, one of the key factors is to prevent a recurring stroke. You must take all precautions as possible to reduce the risk of a recurring stroke, because the survivor, the stroke patient, recurring stroke patient survival records are poor. Are poor. All right. So what is the strokes impact? What are strokes and how does it affect us? Everybody knows that when you have a stroke, the first thing is that the stroke will affect your cognitive function, right? Cognitive function. What are the things that has been affected if you have a stroke? A stroke patient basically will suffer from cognitive impairment, and actually in a more severe form, actually you have a dementia. right? So this is actually the most common types of cognitive impairment for stroke patient itself, right? After the stroke, most patients will have a stroke, sleeping disorder we call insomnia itself. 50 to 60% of them will suffer from insomnia, right? And 40 to 60% will suffer from some form of physical functional disability itself, right? Then about half of them will suffer from fatigue, right? And then the rest will suffer from more than one other medical conditions. Also, 30 to 40% suffer from apathy, which is actually a lack of feeling. That means the person will become very cold, very cold, no feeling that, and then having depression and anxiety. These are very common post-stroke patients' behavior, and it is a long term. These are long term, and you can understand from here that the burden of a stroke patient on care is very, very heavy, right? Very heavy. So the control of vascular disease risk and prevention of recurring stroke are the key to reducing the burden of cognitive decline and post-stroke dementia. So important for a person who are suffering from stroke, all right, likely that they will suffer from a series of disability and cognitive impairment, as they show in this chart itself. Now, important thing to make sure is that this condition doesn't get worse, and also prevent a second stroke from occurring. All right. Now, you look at it itself. The stroke and dementia are very actually closely related because it affects your brain, all right, of course, right? So the prevalence of actually stroke dementia are very high. Years after the stroke, the first year after the stroke, the prevalence rate of dementia is about 20 to 30%. But 3 to 5 years after the stroke, the prevalence rates go up to 30 to 40%. So actually, it's very important to prevent the onset of dementia, especially for the stroke patient, because stroke patients are very prone and at high risk of suffering from dementia. And having dementia is a major, what they call burden for the care, patient care. People who actually take care of a dementia patient will tell you that it's actually a very, very heavy burden, all right? So now, one thing that can help to prevent or slow down dementia, risk of dementia, actually is exercise. In this chart, you can see from here that compare with persistent exerciser, and if you are not having exercise, actually, the incidence of suffering from stroke, ischemic stroke itself, from dementia, the probability of suffering from dementia itself, right, actually is much higher for non-exerciser compared with the persistent exerciser. Okay, right. So important is that exercise can help to reduce the risk of dementia for stroke patient. And for stroke patient, the first very important recommendation of lifestyle is that do exercise, keep exercise, right? Do not stay sedative in life. All right. So another one, actually, if you look at itself, is that even hypertension, without a stroke itself, right? The hypertension also increase the risk of dementia, right? In this case, if you are having a hypertension of 146 to 185 systolic blood pressure, right? Your risk of having a cognitive impairment, which is actually dementia, is 8.6 times compared with a normal person with no hypertension, right? So therefore, keeping the blood pressure low is important, right? Now, another way to look at it itself is that the younger you are in suffering from high blood pressure, the higher your risk of having dementia. You can see from here, right? For people age 40 to 59, right? If your blood pressure is going up, your risk of having what we call dementia go up very, very sharply. Compared with old people, which actually having hypertension, their risk of dementia are almost flat at 70 to 79 years old. So the younger the age you are having hypertension, the higher the risk of having dementia, right? So that's a point. Both apply for the systolic blood pressure as well as diastolic blood pressure. It really doesn't matter. You can see from this chart itself. So the younger you are having hypertension, the higher risk of having dementia you have. All right, now, what are the neuroregeneration nutraceutical compound that we can take for stroke recovery or for people who actually are recovering from stroke? So what are the good supplements? So in here, I listed the relevant supplement that actually is helpful for stroke patient to take, right? Among the top one actually is acetyl L-carnitine, right? Followed by alpha lipoic acid, astaxanthin, B12, CoQ10, plasma lotion, which I think those who are in anatomy will be familiar with this product, omega-3 fatty acid, magnesium, and zinc. So other than acetyl L-carnitine itself, I think that all these compounds from ALA to magnesium itself, I think are available in the offering of autonomy product portfolio. So you all should have a good reference on that. Now, the herb side, herbs that is beneficial for stroke patients are typically the Chinese cat's claw, right? Goten, curcumin, right? Ginkgo biloba, right? Pentax ginseng, which is our ginseng itself, and Pentax noto ginseng, which is in Chinese is a sanqi or tianqi, right? So this is not ginseng, this is a different form of herbs itself, right? So in here, I think that those who are familiar with Atomic product itself, ginseng will be there. Ginseng will be the Hong Sandan. Ginkgo biloba will be there because ginkgo and natto is one of the product composition in one of the product itself, right? Curcumin basically not so much, but I think there is also what they call a turmeric extract that is in product portfolio. All right. Now let's talk about another complication, which is actually the coronary heart disease. This is a disease of the blood vessel supplying blood to the heart, right? Basically, we are talking about bigger context. Basically, we are talking about our blood vessel get damaged and narrowed, right? This is a term we use as atherosclerosis, right? So hypertension basically will damage and narrow our artery itself, right? Resulting in a condition we call atherosclerosis, right? Now, if the atherosclerosis happen in the artery that is supplying blood to our heart, then we have what we call the condition we call chest pain. We have it can cause us irregular heartbeat, and it also can cause heart attack. And this actually fall under the category of what we call coronary heart disease, whereby our heart artery are being blocked itself, right? So what are the current tests to diagnose atherosclerosis itself? There are quite a few tests that you can actually go and examine and see whether that you're suffering some form of artery block or not. One of them is angiography. The other one is actually using EKG stress test. The other one we can use is actually the EBCT, which is a computed tomography, right? Electron beam computed tomography. And also you can use the ultrasound on the carotid artery ultrasound itself, right? Now let's look at the coronary heart disease, actually the risk factor. Now, how does it relate to hypertension? Now you can see from here, right? This chart shows that actually as your blood pressure go up, your risk increases itself. Now, one significant thing in here is that actually for the heart disease, the coronary artery disease itself, right? The systolic blood pressure is more important than the diastolic blood pressure. If you look at this chart, it tells you that actually your upper reading of the blood pressure, the higher reading of blood pressure is more carry higher risk for your heart disease than the lower reading blood pressure itself, right? So for people who are suffering from coronary heart disease, beware that you should control your systolic blood pressure more than worry about the diastolic blood pressure, okay? Right, so again, as you age go up itself, your blood pressure, if you're suffering from hypertension, the higher the hypertension, the higher your risk of having suffering from the heart disease. All right. Now, what are the symptoms of heart attack? Right. So we talk about coronary artery disease. One of the acute complication actually is the heart attack, right? So here we need to recognize the symptom of heart attack because it is an emergency, right? We need to actually quickly address if you have symptoms of this itself. So in here, I show you, right, this table here for both men and women, the most common symptoms of heart attack are chest pain, and the pain may spread to the back, neck, arm, or jaw, right? And you also are breaking out cold sweat, which means that usually, apart from the chest pain, you are also sweating, having cold sweat, all right? Now, and also very common, actually, you have short of breath. Now, these three that I marked in red are the most common symptom of heart attack, both for men and women itself. Other symptoms can be severe vomiting, irregular heartbeats, dizziness, weakness, indigestion, or heartburn, but it could be also mistaken for other problem. So therefore, very important to recognize that if you have chest pain and the pain spread to the jaw, the back, neck, or arm, and at the same time you are having cold sweat, that is actually the first sign of heart attack, right? So of course in here, if the pain occur in the left side, chances are that most likely that you are having higher probability of heart attack. The right side may be a bit less risk itself. But to me, my advice is that regardless of whether your left side pain or right side pain, if you having chest pain and cold sweat, don't wait. Just go for call an ambulance. All right. Now, what is the risk of heart attack if your artery is blocked? Right. So in here, I show you a chart. Right. So in our heart, we have four main artery that supply blood to our heart itself. Right. So here is a chart showing your artery blockage relation to your probability of survival over what they call 72 months, which is 6 years, 5 to 6 years time, right? So if you are having one artery block cell, your probability of survival is in the red line here over the years as you go. But if you're having your 4 artery also is been blocked, right? Your heart artery is blocked. Your probability of survival over time is the yellow line that you can see from this chart, which actually dropped very drastically itself, right? So you can see from here, right? Number of artery calcified. If your artery is calcified is 2, your mortality at 72 months is 30%. If your artery calcified is 4 artery, right? Then your mortality at 72 months is 73%, right? So, friend, if you are diagnosed with your heart blood vessel blocked, don't wait. Go for medical intervention immediately. Don't hope for taking internal medicine to solve the problem. You look at this chart, the first advice is that don't wait and go for medical intervention as soon as you can arrange. All right. Now, what are the treatment options itself? So currently, the standard treatment option is that if you have 1 or 2 artery blockage, right, you will undergo PCI, which is a percutaneous coronary intervention. Basically, it's saying that you are having angioplasty in your coronary artery to permit your blood flow in there. So the angioplasty itself can be a balloon or a stent. All right. So this is quite common nowadays, right? So you have 1 or 2 artery block, you basically go for the balloon or the stent. Doctor will recommend you. And basically, I think this procedure will good for 4 to 5 years, right? Now, if you're having more than 3 artery blockage, which is 3 or 4 artery blockage itself, then the doctor will most likely advise you to go for the artery bypass, right? So we call a coronary artery bypass graft surgery, which is in short called CABG, right? So CABG is basically taking an artery from your other part of your body, your legs itself, and then bypass it, join it to your artery that's blockage and bypass the artery itself. Now, this procedure is good for 15 to 20 years, right? So generally, if we look at it itself, although that this is a much more major surgery compared with PCI, CABG, but actually the CABG itself actually can last longer. It's good for 15 to 20 years. All right. Now, another complication out from hypertension actually is the heart failure, right? Let's look at the risk factor for heart failure. Now, in here itself, the risk factor for heart failure highlighted here is actually the hypertension. Hypertension is among the high risk factor, the third one. Actually, the 2 other risk factors that actually that can contribute to heart failure, One is actually the previous arterial fibrillation, which is you have a previous history of a irregular heartbeat, right? Or you have a previous history of heart attack. So these two are actually a medical condition that have a precondition. But most of us, if you don't have these two conditions, one of the highest risk factor is hypertension. Now, unfortunately, right, heart failure is not an acute. It's not an acute incident, right? Heart failure occur gradually over time. All right. So if you look at it itself, right, let me show you the prognosis for heart failure. Although that is not as acute or as fearful as a stroke or heart attack, but heart failure is actually a very a critical silent killer in that, right? Now, if you are suffering from class 1 heart failure, which means that basically in this case, a lot of us actually do have, as we get old, we actually have what they call some form of heart weakening itself. And in this case, class 1 heart failure, basically, there's no symptom at all. No symptom with normal activities. We won't detect any symptom. But even that itself, if you are suffering from class 1 heart failure, all right, your 5-year mortality is about 20 to 30%. Now, when you are suffering from class 2, which means that you have a slight limitation of activity, symptom with ordinary exertion, that means that when you exert yourself activity and you have some symptom coming out, right, then your 5-year mortality actually is increased to 30 to 40%. Now, when you are suffering from class 3, which means that even as when your activities are very much constrained, because the moment you do a minimal exertion, you have symptoms of palpitation, symptoms of short of breath, all that itself. Then I can tell you that, right, under this class of heart failure, right, your 5-year mortality actually is exceeded 50%. So you can see from here that actually heart failure is a very serious silent killer, right? Because if you're suffering from it itself, and when you have any symptom already, actually your chances of survival actually get very much lower, right? So in here, right, one of the things is very interesting to see, compared with all other cardiovascular diseases itself, how effective is reducing our blood pressure, especially our systolic blood pressure, the higher reading of the blood pressure. In fact, the reduction of 5 mmHg mercury mark of systolic blood pressure actually can reduce our heart failure reduce the risk by 58%, which is one of the most significant risk factor reduction actually you can do. So therefore, for people who suffer from heart failure, focus on reduction of your systolic blood pressure, because that is the single most critical factor in helping you to reduce the risk of heart failure itself, right? Heart failure patient, very important to keep the high reading of the blood pressure controlled and reduce the blood pressure of systolic blood pressure. All right, now what are the natural compound that is actually suitable for heart failure? Now, this is very different from a lot of people who thought that, taking omega-3, right? Now, all the other compound, example, using omega-3 as an example, are not beneficial for people who suffer from heart failure. It's beneficial people who suffer from the cardiovascular diseases, because it helps the blood vessel, but it does not help the heart pump. All right. Now, compound that can help the heart pumps are, right, in here you can see from here, hawthorn, right, asparagus, ginseng, and CoQ10. So among the 4 there's credible compound that we have itself, right? Actually, 3 of them, in fact, 3 of them are considered as herbs. Only CoQ10 is considered as what do you call? I will call it an enzyme. Okay, I call enzyme. All right. So therefore, if you look at it itself, asparagus and ginseng are a common TCM herbs. Even the hawthorn is, but in fact, hawthorn in a Western country has been recognized as a treatment option for chronic heart failure. In fact, so this is actually one of very important supplementation for heart failure patient. So these are very different from the cardiovascular supplementation itself. All right. So when we talk about atherosclerosis disease itself, now we are talking about the hardening of our blood vessel, but our blood vessel cover our whole body, right? So therefore, it is very common to expect that if you are having a blood vessel that's affecting your heart, your blood vessel in other part of your body also might be similarly affected, right? And therefore, there is a very common understanding that if you are suffering from one form of cardiovascular diseases, you can see that there is an overlap of it. So heart disease patient will have overlap disease of cerebrovascular disease, which is the brain, blood vessel of the brain, and a peripheral artery disease, which is the blood vessel of your artery, your legs and your limbs, your limbs itself. So there is a very important understanding that when you are having a blood vessel clot, your blood vessel doesn't only clot in a particular part of your body or organs. In fact, it affects your whole body. So what you are going to deal with is not just only the heart problem, right? A heart blood vessel problem. In fact, you should look at it itself and deal with every part of your body simultaneously. All right. So let's look at one of the complication, which is the blood vessel that's affecting our peripheral artery itself, right? So very often, I think that older people will find that they have legs, what they call pain, having pain. But this pain is due to the blockage of the artery that going to your legs itself. And depending on the blockage at which part, the higher the blockage, then the pain will be on the thigh. But at the blockage at this part, then the pain will be on this part of the itself, right, on the foot itself. Right now, but it's very common. One of the common symptoms of this type of blockage is that as you exert yourself, the pain will go up. But as you stop exerting yourself, the pain will subside. Right. So we call this symptom intermittent claudication. Right. So it's important. Right. If you are having pain, the suffering from as you move, exert, your pain get increases in intensity, then you should go for medical checkup and check whether you're suffering from any of the PAD. So, all right, now you look at it itself, how fearful is PAD? Again, it might not be as deadly as the one that I show you in the heart disease itself, but then you can see from here that even if you're suffering from PAD, and the 5-year mortality rate for even asymptomatic PAD is 20 to 30%, right? So if you're having intermittent claudication, which is a lot of us who are having that in the pain, when you walk, you're having pain, maybe, right? Then your 5-year mortality is about 30%. This is quite significant, put it that way, right? So the more severe is your blood vessel in the peripheral get blocked, the more higher your chance of actually suffering from death itself. So you can see from here that the survival rate drops if you are having severe symptom of PAD itself. You can see the survival drop very, very rapidly, right? In fact, over the years, within 10 years, it dropped to 25% survival. So it is also a very important complication. Okay, what are the natural options we can have for people who are suffering from atherosclerosis itself? Now, here listed in this table is 3 medicinal compounds, which means that these 3 are actually in use as anti-thrombotic compound in there. In fact, nattokinase, lumbrokinase, and pendex-notoginseng, these 3 compounds are used in TCM context for anti-thrombotic diseases application, right? So I will leave it for you to go look at the reference and the results, but these are basically just to let you know that they are compound that actually, apart from Western medication and drugs itself, actually TCM side also have their own anti-thrombotic compound offering. All right, now what are the supplements? This is what we are more interested because this is what we are thinking that, what are supplements that's beneficial for us if we are suffering from some form of what they call atherosclerosis itself, right? Anti-thrombotic action are the garlic and nattokinesis. I put nattokinesis here is because over the years, nattokinesis also have can be obtained through as a health supplement. So we all know that. So anti-calcification function, the vitamin K2. Vitamin K2 has now recently emerged as a good vitamin that can prevent calcification of a blood vessel. So in that context, it helps in actually slowing down the atherosclerosis and prevent atherosclerosis from occurring, right? Then anti-inflammatory products like curcumin, garlic, and omega-3 fatty acids are useful because anti-inflammation also basically helps in actually the relief of atherosclerosis condition. All right, now another hypertension complication that's very common is actually the blood vessel in our eye is affected, and it's very prevalent, right? For even mild hypertension, the prevalent rate was actually 25%, right? For severe hypertension, almost close to 80% of the patient will have eye retinopathy, which means damage to the blood vessel in the eye. And a very typical symptom is that you can see from here, the bloodshot eye. The eye that is actually the blood vessel actually is really bursting out on that. So these are very typical hypertension complication of the eye. Okay, now we talk about hypertension. Now we should talk about one very important part is that what happens if a hypertension is high and out of control. We call it hypertension crisis. Now, what constitutes a hypertension crisis? Which is when your blood pressure rises above 180 systolic, 120 diastolic, right? When your blood pressure rises above 180 and 120, you are suffering from a hypertension crisis. And typically, if you are having this type of blood pressure level, right, you will have severe headache, you will have nose bleeding, you will have shortness of breath, and you have severe anxiety. Now, this condition require prompt action to reduce your blood pressure. So over the days, over the hours and days, you should go and seek medical attention already. Don't delay. Don't delay. It's not immediate, but then at least between the day or so, over the few hours or within the day, you should go and seek medical attention if your blood pressure is persist at this level. Now, however, if you are having this level of hypertension, blood pressure, and you have symptoms of organ damage, what are the symptoms of organ damage? Chest pain, back pain, numbness, weakness, change in vision, difficulty speaking, or shortness of breath itself, right? Then it constitutes a hypertensive emergency, which means that you need to immediately seek medical attention, right? So important, if you are suffering from high blood pressure and you are accompanied with symptoms of chest pain, back pain, shortness of breath, don't wait. Go to emergency hospital, go to a hospital for treatment, send to a hospital. All right, now in TCM context for people who suffer from hypertension, right, I just want to recommend and mention that there is acupoint that's actually quite effective. Is because there's quite a few studies confirming the application of it itself, right? This acupoint is what we call the 内关穴. So pericardium 6, PC6. So this is actually in technical term in the meridian side itself. If you look at meridian, TCM meridian itself, it's actually identified as PC6. PC6 is actually as shown in this, your hand there. There is actually 3 finger space between your edge of your hand base here, and that the red point is actually where the acupoint, right? This acupoint is actually a very effective acupoint for nausea as well as for reduction of hypertension. So how do you do? How do you apply? Basically you press the P6 acupoint for actually about cycle. That means that each point you massage it for about 20 to 30 seconds and then release it. right? You press it for 20 to 30 seconds, release it, and each cycle repeat for 3 to 5 minutes for each time of the arm. So this will actually consider helpful if you are suffering from hypertension, and if you have time sit down there, if you do a massage on the hand, it will help to also reduce your blood pressure as well. It's one of the proven TCM acupoint actually in a medical study as well, right? So this point also actually can also treat arrhythmia as well for irregular heartbeat. All right, now what are the blood pressure lowering nutraceutical? Now this is the key summary of what we are going to talk about. All right, so in here, I also take the pain to actually extract out the relevant efficacy reading of your blood pressure reduction. So you can make a judgment yourself, right? What compound and on average, how much of blood pressure they help to reduce itself, right? Now here, in terms of the herbs, hibiscus and plantain ginseng are the two recommended one. Then in terms of spices itself, you have garlic, celery, ginger, and cinnamon. So these are very common spices that is very beneficial for people who suffer from hypertension itself. If you look at it itself, celery and garlic are among the better one, the more potent one itself. So therefore, actually, for people who suffer from hypertension, it doesn't hurt to take more garlic and celery in their dishes itself, and the spice as a spices itself. Of course, ginger also help, right? Cinnamon also help. All right, now in supplementation, this is the key one, right? So I list the supplementation from in the order of most potent to the least potent, right? But these are all credible, proven supplementation that have some beneficial effects on blood pressure lowering itself. The highest on the first on the list is actually the CoQ10. In fact, for blood pressure lowering supplement, actually CoQ10 stands as number one because the potency is there. Unfortunately, right, the CoQ10 lowering of blood pressure is not a straight line. That means that your dosage doesn't increase and your blood pressure reduction efficacy doesn't increase proportionally with your dosage increase. In fact, there is a J dose response effect. I will explain shortly, okay? Which means that there is an optimum range of CoQ10 intake for you to lower blood pressure. Not enough of CoQ10, the blood pressure is not going to come down. Too much of CoQ10, the blood pressure go up, right? So that is the meaning of J dose response. I'll show you a chart on this later. Now followed by L-arginine, right? And alpha lipoic acid. These two itself, I think that in the atomic site, ALA is one of the alpha lipoic acid is very common. You can find in one of the products that contain this. I'll leave for Atomian to actually do your own homework, right? Because I've covered enough some of those products in that. And one of the products actually that having alpha lipoic acid are also beneficial for the lowering of the blood pressure. Then followed by nattokinesis, right? Omega-3 fatty acid. So omega-3 fatty acid basically is an anti-inflammatory compound. Their effect on lowering of blood pressure are not so pronounced. You can see from here, not much of a 2 point and 1 point in terms of that itself. Also, omega-3 fatty acid have a J dose response effect, which is very similar to coenzyme Q10 I just explained. So therefore, for those compounds that have J dose response effect itself, a matter of advice and caution to all the listener here, right? That means that there is an optimum range of dosage. Too high and too low are bad for the are not recommended because you have negative effect on the effects on itself. So therefore, be very careful about compound that have J dose response effect itself, right? So same thing, magnesium also actually are able to help to lower some blood pressure, not significant, right? But also some most of a lot of people also say that okay, if you have hypertension, it helps to take magnesium. But if you look at it itself, again, potency are not high, and these also have a dose response effect as well. right? So I would recommend you actually, if you have hypertension, you use omega-3 or magnesium really as a key supplementation to help to reduce your blood pressure. But instead, in fact, if you want, actually, you should go for CoQ10, L-arginine, ALA, right? These are actually a high level of evidence and a high potency compound that can help you to manage your blood pressure. All right, now let's look at the CoQ10, as I mentioned, right? We call J curve response effect. Now, this is a chart of the SBP, the systolic blood pressure, and the diastolic blood pressure bottom, right? And you can see from there, as a CoQ10 dosage increases itself, your systolic blood pressure drop to a point, then it come up again as your dosage go up, right? So you can see from here that there is an optimum dose for you to take in CoQ10 to lower blood pressure. The optimum range is between 150 to 230. This is actually the best range itself, right? There is a limit, maximum limit you should take. In fact, in this case, you can see from here that slightly above 300 milligram per day, right? Then your blood pressure is going up already. It's not coming down. In fact, it's going up, right? So therefore, there is a maximum limit of taking CoQ10 for lowering of your blood pressure. Although that is very potent, is effective, but you must take it in the right range itself. Same thing, the effects of blood pressure apply to the diastolic blood pressure, which is the lower reading. Now, this Atomy blood pressure lowering supplement. Now, this is a summary, right? Here we have the Homsandan, right? Homsandan itself, this reports actually on red ginseng, itself show that effectively Homsandan can reduce the blood pressure by 6 point SBP and 5 point by DBP. Quite okay, quite high, quite high. So actually ginseng, Homsandan is a very effective supplementation to lowering blood pressure. Now, this actually carry another thing that I want to remind everybody. A lot of people say that taking ginseng will increase your blood pressure. This is not true. There's a misconception on that. The fact is that most of the study, in fact, today on ginseng itself, show that ginseng are able to lower blood pressure, not increase the blood pressure. So drinking ginseng, sometimes people feel heaty, is not equal to having raised blood pressure. So remember, it's totally different context altogether, right? Don't confuse with that. Blood pressure is a measurement that you can detect, and therefore, if you drink ginseng, the study have shown that ginseng are able to lower blood pressure, help lowering blood pressure. Another one is actually the omega-3 we talk about. So in this case, I talk about for Atomy, there's two products. I will talk the RTG omega-3 because RTG, the bioavailability, it means the absorption are better. But the potency for lowering the blood pressure are not that high. But having said that, right, it helps in lowering blood pressure, but it also helps in actually cardiovascular disease risk reduction. So therefore, you are taking omega-3 not just for reduction of blood pressure. Actually, omega-3 have a broader spectrum of benefits other than lowering blood pressure. All right. So another one, which is I think in this case for people who are suffering from hypertension should take, is actually the ginkgo and natto. So this actually the natto is nattokinesis that we just talked about. All right. So the effectiveness of the blood pressure reduction, if you look at it itself, is quite potent for the SBP. Right, might not be as high in the DBP, but SBP is 5 point, in mercury point. So it's okay. So I think it's quite relevant and effective itself. Right. Then we have another compound that's containing magnesium. In this case, again, Atomy have a few products that contain magnesium. I will choose the triactive calcium as an example here. So in this case, triactive calcium not only have calcium, but also actually have vitamin D as well. So I just want to say tricalcium, why I choose, because in there's a higher amount of vitamin D in tricalcium, whereas the other calcium, magnesium of Atomy product doesn't contain vitamin D itself, right? But the reduction in the blood pressure are not so potent. Okay, now let's look at the product on ginkgo and natto. You can see from here the application. Ginkgo and natto is a very good product that is actually suitable for people who are suffering of cirrhosis, right? So if you have hypertension, you are having deep vein thrombosis, which is actually one of the complication of cirrhosis itself. You're suffering from coronary heart disease, which is a complication of hypertension, right? You're suffering from transient ischemic stroke or previous heart attack. Also, you're suffering from PAD itself. All these are suitable application area for ginkgo and natto itself, all right? Also including your chest pain, which is actually heart disease, symptom of heart disease itself, right? Right, now in here, I just want to mention, every product that have its potency, right, has its medicinal value, also carry its limitation and risk, right? That principle applies across the board for all products itself. If your product show potency, you also should have its toxicity level and safety level as well. Now, so you must know what are the people that should not take ginkgo and natto. In this case, people who are suffering from breathing disorder, people who have low blood pressure, which means that there's no need for you to take ginkgo and natto anyway, if you are suffering from low pressure, and people are undergoing surgery or planning to go surgery itself, should stop taking ginkgo and natto. Remember? Now, very important in here is that for people who suffer from low platelet count, right? So low platelet count can be caused by a variety of diseases like suffering from leukemia, anemia, or your dengue fever, or you're under chemotherapy, or you're actually a heavy alcohol drinker, and so on, right? All these conditions can result in your low platelet count. And you are suffering from a low platelet count means that you have a risk of bleeding. And in this case, you should not take ginkgo and natto as a supplementation. This is contraindicated. All right, now Hong Sandan, as I say, I like Hong Sandan because ginseng is a very powerful, potent, wide spectrum herbs that can use in a wide spectrum application and benefit us itself, right? So you can see from here that ginseng can be used. In fact, the Hong Sandan is a very standardized, high concentrated extract of ginseng. I have mentioned earlier in a lot of my talks itself. The uniqueness of it itself is a medicinal product because it's standardized, it's highly concentrated, and it's standardized. Its active ingredient amount is standardized. So it can be used as a medicine because the dosage are standardized and we know how much to take according to the requirement or indication. So in here, you can see from here that it can help to improve mental, physical performance, especially for people who suffer from chronic fatigue syndrome, right? It helps in people who suffer from dementia, right? Memory disorder, Alzheimer, which is affecting his nervous system, especially for stroke patient in this case, right? It helps people who suffer from diabetics patient and some people who suffer from cholesterol problem. And here, in particular, we're talking about it helps people who suffer from irregular heartbeat, coronary artery disease, right? Heart failure, hypertension. Now, notice heart failure, and it also helps in hypertension, all right? So you can see from here that the ginseng actually is a very wide spectrum, high potency medicinal product of high value itself. And Atomic Hong Sandan is one of the few products that I would strongly recommend because it's actually very concentrated and standardized. You don't need to take more. In fact, recommended dosage is always 1 pack per day is suffice. It's high potency. All right. Now, caution. As I say, high potency comes with always also some risk. So who are the people not suitable to take Hong Sandan? Pregnant, breastfeeding, children under 6 years old, you are suffering from severe kidney diseases, you are suffering from severe liver diseases, especially like cirrhosis, and you are suffering from bleeding risk, like aneurysm, right? So these are the people that is not suitable to take ginseng, right? And also ginseng, I have a lot of interaction with Western medication. So if you are taking all this medication, especially like, painkiller, anticoagulant, aspirin, or you take steroid, right? You need to make sure that you space yourself at least 2 hours with ginseng drink, right? Don't take ginseng and the medication together. right? So this is a very important precaution that you must take. All right. Now, I have attached in the chat side this form, right? This is a self-assessment of your stroke risk. I wouldn't go to it. You all do your own assessment, and the outcome of it itself, based on your score, you'll see that whether your risk is high, very high, or moderate. For those who are actually scoring a high or very high, I suggest that you do look at adjustment of your what you call a lifestyle, and then have some effective supplementation to help to reduce your risk itself. All right. So, okay, this is the end of my session. I pass